Really nice to be with you all today. And again, thanks for giving us the opportunity to share with you all the work that we've done. And we're really grateful to WageIndicator for also this collaboration, sharing data with us. And we look forward to discussions with the audience. So I'll go through a little bit of a background just to give context for why we got into this work. And Nyla will actually go through the research that we did, and then Chioma will walk us through what we've done with the research and what are kind of our way forward. But just to introduce GAIN, if some of you don't know who we are, GAIN is a nutrition foundation. We were founded by the United Nations in 2002 to tackle the human suffering caused by malnutrition. And we're driven by a vision of healthier diets for all people, especially the most vulnerable. And we do this through improving food systems. Thanks. So I'll just get us kicked started a little bit. I'm not sure how many of you are familiar with the global nutrition context. But basically the burden of malnutrition in the world is quite large. At least 1 in 3 people suffer from some form of malnutrition. It comes in the form of overweight, obesity, which are often considered overnutrition, of whom there's about almost probably 3.5 billion people who suffer from this. At the same time, we have undernutrition or chronic hunger, which still affects about almost 500 million people. And then interestingly, we have something called hidden hunger, which is micronutrient malnutrition, but about half the population in the world does not consume enough micronutrients. And so we have about 2 billion people who suffer from some form of micronutrient deficiency, the most common one being anemia. So as you can tell, most of us on the planet need a little bit of help with food and appropriate diets to meet kind of all of our nutritional needs. So GAIN realized that, in trying to address the burden of nutrition in the world, there is an important and relatively untapped opportunity to address this through working through workplaces and employers. And this is because we know the majority of the adult working population is employed or informally or formally, but spends about a third of their time at work. And this means that they're also consuming food at this time. And in some workplaces and work contexts, as much as 60% of people's calories and food intake happens during working hours, at least 30% and sometimes up to 60%. And so when you think about the entire global working population, which actually we'd love your statistics on this, but we understand is up to 3.4 billion people, workplaces really offer an incredible opportunity to influence diets and hopefully improve them to address some of these malnutrition issues in the world. Next slide. And workplace diets are also linked to productivity and health, disability, and even death. We know that poor diets weaken immune systems, impair cognitive functions, and is the second largest cause of non-communicable diseases in the world. And NCDs are the rising kind of concern of diseases in the world as opposed to infectious diseases. Aside from tobacco, poor diets are leading basically the causes of NCDs. And this costs billions of dollars in lost productivity for businesses and lower wages and incomes for workers. But it's basically those who suffer from NCDs or reduced immune systems all affects our health and our ability to work. And probably more importantly, NCDs are also the leading cause of death and work-related illness in the world. So all this to say that addressing diets is important. It affects all of us. It affects workers. It affects employers and governments. So recently we've been working with the ILO to consider how well occupational safety and health regulations and policies um, integrate nutrition into some of the policies that exist, and it's not as much as we think. Part of that work, we also wanted to look at the perspectives of workers, and for that reason, we looked into collective bargaining agreements. And we wanted to understand the same thing. To what degree do collective bargaining agreements discuss and cover nutrition? Is this a topic that's material for workers? Are they interested in nutrition? Are people aware of the issues of this burden of malnutrition? So that's what got us kick-started on looking at collective bargaining agreements and nutrition. So with that, I'll hand over to Nyla, who will talk a little bit about the research that was conducted.